Okay, so let's unmute Karen and um, get her question. Karen Kirsch, correct? Pronounce that right?
Yep, that's right.
Okay.
So Secretary Azar said that there was no spike in the states that opened up early.
Mhm.
Um, of course, I went online and immediately looked at things, and there were people in Texas that were claiming that that's not true, that cases are going up. So I'm wondering, is there a different definition of what a spike is? Georgia opened up about 3 weeks ago, and I think Texas opened up April 30th or May 1st. So I'm wondering if that's indeed true. And I did see something about some data coming out of Texas was not put in chronological order, or no, coming out of Georgia was not put in chronological order
Mhm.
as
Yes.
well, which is a little bit shocking to me. So could you address those two things?
Yeah, sure. Okay, so there's all like if you've been coming to these town halls, you know I try to explain everything with a short answer and a long answer and a histogram in between. So, the short answer to the question that you initially posed is, yes, there are spikes, and those that are trying to urge us to reopen the economies of our states and then try to reintegrate into our societies. um, they have a way of describing the data as anomalous, right? So it's been declining for 15 days or 10 days or 12 days, and then there's a sudden rise. And that to them is just an anomaly, but to us, in the who are looking at it clinically and epidemiologically, it's actually something is much more concerning, and that is definitely what we describe as a spike. Reopen the economies of our states and then try to reintegrate into our societies. They have a way of John, we've got a big delay. Sorry about that. Anyway, um, so it is, any spike. If you don't see, like, if you see the Italy graph, there's day-to-day discrepancies, but the linear regression is on decline. All right. For us, that's enough. For biostatisticians and those that are really examining, the details of this, they have to find explanations, and those have to do with staffing and all this other stuff. But as long as we're seeing a very significant day-to-day decline, anything that blips up at the end of that is significant. Okay, it's significant because we know that the incubation period for this, which I was mistakenly calling it latency, but anyway, semantics. The incubation period for this could be as short as 3 to 4 days, where 3 to 4 days after you have exposure to someone with this virus, you can start developing the symptoms, or it could be as long as 14 to 21 days. Okay, so if you've had this 14-day decline, and then all of a sudden you let people begin to reintegrate, that blip is actually coming from somewhere back there. All right, so somewhere back there was a failure in the containment and the strategies of mitigation. All right, so the longer that decline is allowed to take, 14, 21, 30 days, with less of the spikes along the way, the more confidence that you have that containment is working. If all of a sudden after 14 days you're like, okay, let's go, everybody go to the bars and everybody, go to the restaurants, then you're going to see these. You're going to see these emerge. And it's not necessarily a result of reopening on that date. It's a result of not waiting long enough. Okay. Some would argue that it's both. That some would argue that you reopen and 3 days later you see this, or 3 days after a protest where everyone showed up without masks, you'll see this. That may be also true. Okay, that may very well be also true. As far as that's the that's the semi-short answer. I guess the longer answer is that we don't have a unified national strategy. The states have been allowed to make their own decisions as to how and when to reopen. The CDC guidance has not been implemented the same way by all the states, and therefore you will see certain states succeed at reopening, and you'll see inevitably you'll see other states fail at it. It is what we expect. Okay. Before this, when John and I were setting up, one of the important lessons from Italy was that for at least January and February, not many national governments at the national level were taking the pandemic threat seriously. When Italy began to get its healthcare system overwhelmed, when patients were dying on respirators, when they were running out of respirators, when the death counts on a daily basis in a particular region were, the first time it crossed 300 in a day or crossed 500 in a day, then that was the alarm bell, right? So I think the alarm bell for us in this reintegration will be looking at states that have rushed forward to experiment with their economies having to, deal with all of this, and whether or not they have appropriately given guidance to people in these workplaces on how to protect themselves and their clients. Unfortunately, their failures are going to teach the states that waited longer, they're going to teach those states those lessons. So there's that. I hope maybe I answered the question.
No, you did.
Okay.
I guess as far as Georgia is concerned, how the chronological error is that?
That's just poor reporting. I mean, as far as I understand it, that is just very sloppy. Again, all of these health departments at the state level, if they had a standard protocol, then for reporting, if they had a standard way of assigning, that to the doctors and the healthcare systems in their state, look, this is what we need from you when we get a report of a death. How did you determine the patient died of COVID? When did you determine it? Was it pre-admission? Was it, and then how? Obviously, how? What kind of test allowed you to say that this patient was COVID? Because the variety of tests and evidence that is being brought forward to determine that a patient has COVID is unbelievably varied. Okay. It could be the swab test, or they'll forego the swab test and they'll do a chest x-ray. The chest x-ray, is showing, pneumonia, or it's a CT scan that's showing the pathognomic ground glass appearance. Then there's no testing. There's no molecular testing. They've just said, okay, this is definitely COVID. Move them to the COVID ward or move them to the ICU and put them under containment. So if we had a national guidance to say, okay, everyone, listen, this is how we need you to diagnose these patients, and then everybody did that, or 99% of people did that, then we would have cleaner data. Right now we have chronologically poorly curated data. We have molecularly poorly curated data. We have clinically poorly curated data, and which each level of complexity, adding confounding data, the reporting is going to be unreliable. Does that make sense?
Yes, it does. Basically, our picture is skewed a little bit because the feds aren't really standardizing things.
Yeah, and look, we're not alone. So let's also look at the UK. We spoke to a doctor from the UK a couple weeks ago. who says that even NHS, which is held up as a paragon of, of,
Yeah.
of central, medical excellence, trying to do evidence-based medicine, trying to establish kind of a standard of medical excellence across all these disciplines, even, held up as a paragon throughout the world as the way to potentially do healthcare the right way. They have failures, big failures, big failures. France, Italy. Italy is ranked the third best healthcare system in the world. I'm sorry, in Europe. We have success stories in Germany, but again, like I talked about in the very beginning of this town hall, if you're good at containment, then you won't have to get to the point where you start being bad at mitigation. Okay. We blew through containment, as did most of or all of the European countries. And then they struggled with doing mitigation properly. So we're not alone. The United States is not the only country that has shown that it's not good at this. The country that's shown that it's good at this is South Korea, because they actually had to go into past containment and into mitigation. They did mitigation well. New Zealand and Taiwan didn't get there. They just stopped it at containment, right? So what that does is it buys you time to get your apparatus right. Your public health apparatus needs to have track and trace. It has to have standardization. It has to have protocols. We didn't have any of those. Neither did the European countries. So, and we still don't. While we're seeing European countries begin to standardize, we are about, just as we were in March, we're about 2 to 3 weeks behind they are. So not only in the addressing of and treating the patients, right? We're also behind in standardizing. We're also behind in establishing protocols. We're also behind in track and trace. So, it is easy and expeditious to try and lay blame at the federal level, where there's plenty, but we're not alone.